I want to read you something. Boric acid suppositories, gynecologist approved, clinically proven, safe, natural, and effective for odor, BV, and yeast. Your new vaginal best friend. That is a real product description from a real product. Currently available, no prescription required, on the shelves of pharmacies and the front page of Amazon, with thousands of five-star reviews, with the word gynecologist approved right there on the label. And I am a gynecologist. And I did not approve this. I'm Dr. Anna, and today we need to have a very serious conversation about boric acid suppositories, because I am watching this trend explode, and the gap between what women are being told and what is actually true is genuinely alarming me. Here's what I want you to understand before we go any further. Boric acid is a poison, not a metaphor, not a scare tactic, a literal registered pesticide that is used to kill cockroaches and ants. And right now, millions of women are inserting it into their vaginas because a pretty pastel package told them it was their new wellness essential. I am not here to shame anyone who has tried this. I am here because you deserve the complete picture, the one that doesn't make it onto the product label. Stay with me. Let's get clear on exactly what we're talking about, because the word acid sounds scary, and the word boric sounds almost botanical, and together they've somehow been rebranded as a wellness product. So let me translate. Boric acid is a compound derived from boron, a naturally occurring element. In low concentrations, it has antifungal and antibacterial properties. It has been used in medicine for over a century, historically in eye drops, wound irrigation, and yes, in gynecology, in specific limited clinical contexts. That history is real. That's the grain of truth the wellness industry grabbed and ran with. But here's the analogy I use with my patients. Bleach also has antibacterial properties. Hydrogen peroxide also kills bacteria. That doesn't mean you should be putting them inside your body regularly as a maintenance routine. The fact that something has a biological effect does not automatically make it safe. The dose, the method, the context, and the individual all matter enormously. Boric acid suppositories are small capsules, usually gelatin capsules filled with boric acid powder, that are inserted into the vagina. The capsule dissolves and releases the boric acid directly against vaginal tissue. They are being marketed for bacterial vaginosis, recurrent yeast infections, vaginal odor, pH imbalance, and general vaginal maintenance. Some brands recommend using them multiple times per week. Some recommend them after sex. Some recommend them as a weekly reset. And here is where I need you to really pay attention, because the way these products are being positioned as a routine wellness habit rather than a last resort clinical tool is exactly what concerns me most. Here's what's actually going on, because I want to be fair, and I want you to understand why this isn't simply misinformation made up from nothing. Boric acid does have a legitimate, evidence-based role in gynecology. In cases of recurrent vulvovaginal candidiasis, that's chronic treatment-resistant yeast infections, and specifically in cases caused by a strain called Candida glabrata, which doesn't respond well to standard antifungal medications like fluconazole, boric acid has been studied as an alternative treatment. There is genuine clinical data supporting its use in this specific, narrow context, prescribed by a physician, for a defined course of treatment. That is very different from what is being sold to you now. The jump from boric acid can be useful in drug-resistant yeast infections under medical supervision. To insert this twice a week to keep your vagina fresh and balanced is not a small clinical step. It is a canyon, and the wellness industry crossed it without looking down. Think of it this way. Chemotherapy drugs are used in medicine because they kill rapidly dividing cells. They save lives. That does not mean healthy people should be taking them as a preventative wellness supplement. The logic of, it has a medical use, therefore I should use it regularly, does not hold up. And yet that is exactly the reasoning being used to market boric acid suppositories to women who have nothing wrong with them. The part most doctors don't explain loudly enough is this. Having clinical evidence for a treatment in a specific population, at a specific dose, for a specific condition, under medical supervision, is completely different from that treatment being safe for general, unsupervised, routine use. Those are two entirely separate things. Let me walk you through what the product packaging is not telling you, because there is a lot. The first risk is tissue irritation and chemical burns. Boric acid is, as the name states, an acid. Vaginal tissue is sensitive, mucosal, and absorptive. Direct, repeated contact with boric acid can cause irritation, burning, and in some cases, chemical injury to the vaginal walls. Many women who have used these products report a burning sensation and assume that means it's working. It does not mean it's working. It means your tissue is being irritated. Pain is not efficacy. The second risk, and this is the one I think about constantly, is toxicity if used during pregnancy. Boric acid is teratogenic. That word means it can cause birth defects and pregnancy loss. If you are pregnant, even in early pregnancy before you know, and you are using boric acid vaginally, the compound can be absorbed through vaginal tissue and reach your bloodstream. This is not theoretical, this is documented. Boric acid suppositories carry an absolute contraindication in pregnancy, and yet they are being sold without a prescription to women of reproductive age, with nothing more than a small warning on the back of the box that most people never read. I had a patient, a young woman trying to conceive, who had been using boric acid suppositories twice a week as a maintenance routine because she'd seen them recommended in a TikTok comment section. She had no idea they were dangerous in pregnancy. Nobody had told her. The product certainly hadn't. The third risk is microbiome disruption. I told you in my V-steaming video that your vagina is a self-cleaning, self-regulating ecosystem. The same is true here. Boric acid does not selectively kill only bad bacteria. It disrupts the entire vaginal environment. Used regularly, it can reduce the populations of lactobacillus, your protective bacteria, making you more vulnerable to infection, not less. You can create the problem you were trying to prevent. The fourth risk is systemic absorption. Your vaginal tissue is highly absorptive. That's partly why vaginal medications work. They absorb well. Boric acid inserted vaginally doesn't stay local. It enters your bloodstream. In small doses, your body can handle this. But regular use means regular systemic exposure to a compound that is toxic in larger doses. The long-term data on repeated vaginal boric acid exposure simply does not exist, and the absence of evidence is not the same as evidence of safety. The fifth risk, and this one breaks my heart a little, is delayed diagnosis. If you have recurrent BV or recurrent yeast infections, and you keep managing the symptoms with boric acid instead of seeing a doctor, you may be masking symptoms of something that actually needs investigation. Recurrent BV can be associated with STI exposure. Recurrent vaginal symptoms can sometimes point to skin conditions, hormonal issues, or, rarely but importantly, other pathology. The longer you self-treat, the longer the underlying cause goes unidentified. Here's the part where I tell you what actually works, because I am not going to leave you with a list of warnings and no direction. That is not useful. If you have symptoms right now, unusual odor, abnormal discharge, itching, burning, please make an appointment with your gynecologist. I know that's not as immediate as ordering something off Amazon, but it's what actually gets you an answer. A swab, a culture, a proper diagnosis. BV needs antibiotics, metronidazole or clindamycin, oral or vaginal, depending on your situation. Yeast infections need antifungals, the right one for the right strain. These treatments work because they target the actual problem. If you have genuinely recurrent infections, more than 3 or 4 a year, that pattern deserves a real investigation. Are you on antibiotics frequently? Is your blood sugar well controlled? Are you using scented products, tight synthetic underwear, or other irritants? Is there a possibility of reinfection from a partner? These are the questions worth asking. These are the conversations worth having in a clinical setting. If you've been told about boric acid by a real doctor who examined you, who knows your history, who diagnosed you with drug-resistant Candida glabrata and is prescribing this as a defined course of treatment, then that is a different conversation. In that specific context, under supervision, with a clear indication, boric acid has a role. But that is a prescription-level decision, not a wellness habit. For general vaginal health maintenance, the kind the suppository marketing is targeting, here is my genuine recommendation. Warm water externally, breathable cotton underwear, unscented products only on the outside, no dushing, no steaming, no detox pearls, no boric acid just in case. Your vagina does not need maintenance products. It needs you to stop introducing things that disrupt it. And if you've been using boric acid suppositories regularly and you're fine, no symptoms, no irritation, I'm not telling you that you're guaranteed to have a problem. I'm telling you that you've been making a risk decision without full information. Now you have more of it. What you do with it is up to you. But please, if you're trying to conceive or if you're pregnant, stop today. If you are currently using boric acid suppositories and you have developed any new symptoms, increased burning, unusual discharge, pain, visible irritation, or sores, stop using them and see your gynecologist this week. Do not wait for your next routine appointment. Describe exactly what you've been using and for how long. If you have been using boric acid suppositories and you've just found out you're pregnant, stop immediately and contact your OB/GYN today. Be honest about what you were using and when. Your doctor needs that information to assess your situation properly. This is not a time for embarrassment. It's a time for information. If you've been self-treating recurrent BV or yeast infections for months, trying boric acid, then probiotics, then another suppository brand, cycling through without resolution, that persistence of symptoms is a sign that something needs proper diagnosis. Come in. Bring your history. Tell me everything you've tried. That information helps me help you. What will the appointment look like? A quick visual exam and a swab. We'll look at the sample under a microscope, sometimes right there in the office. And within a few days, we'll have culture results that tell us exactly what organism we're dealing with and what it's sensitive to. That's real information. That leads to real treatment. And it usually costs less than a 3-month supply of suppositories. Here is what I need you to take away from this. The boric acid suppository industry is worth hundreds of millions of dollars. It is built on a foundation of women not knowing enough about their own bodies to question what they're being sold. It takes a grain of clinical truth, strips away every condition and caveat that makes that truth meaningful, and packages it as a lifestyle product. You are not a wellness consumer project. Your vagina is not a problem to be optimized. If you have symptoms, get them diagnosed. If you don't have symptoms, you do not need a suppository. If someone online tells you that you need to reset or rebalance your vaginal pH on a regular schedule, ask them one question: based on what? Because the answer, if they're being honest, is based on nothing. Based on selling you something. You deserve better than that. Your body deserves better than that. If this video made you stop and think, share it. Someone in your circle is buying these right now. Someone is using them while trying to get pregnant and has no idea. Get this information to her. Leave me a comment. I want to know what you've been told about vaginal health that you're no longer sure is true. That list is long, and I have a lot more videos to make. Subscribe. I'm here every week, and I am not running out of things to say. I'll see you in the next one.